Hello students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module we are going to discuss about the fractional curettage and hysteroscopy. So fractional curettage and hysteroscopy is the gold standard investigation to assess the uterine endometrium. So if you want to assess the uterine endometrium, the gold standard investigation is fractional curettage and hysteroscopy. So, as we all know, in any patient with complaints of abnormal uterine bleeding, you're going to do the UPT test, and if the UPT is going to come negative, you're going to do the ultrasound. So, if in the ultrasound you're going to diagnose any specific pathologies, you go with the further management which is required. But if the endometrial thickness is going to be increased, in such patients, if she is fitting under the indications for endometrial sampling, you have to assess the uterine endometrium with the endometrial sampling. So the investigation of choice to assess the uterine endometrium is the endometrial sampling, and this endometrial sampling can be done by either the endometrial biopsy or the endometrial aspiration cytology. But the gold standard investigation is fractional curettage and hysteroscopy. Fractional curettage and hysteroscopy is much sensitive and even more specific than the endometrial sampling and the other procedures. This is because of the fact that with fractional curettage and hysteroscopy, you are actually going to visualize the interior of the uterus, and you are going to take sample from every single part of the uterine cavity. So since you are going to assess the entire endometrium and subject it to histopathological examination, so this fractional curettage and hysteroscopy is much sensitive than the other procedures such as the dilatation and curettage with hysteroscopy and the endometrial sampling as well. Is that clear? So let's proceed with the further discussion about the fractional curettage and hysteroscopy. So this module is going to be a bit shorter module, but then it is also a very important topic as well, right? Okay, so to begin with, before discussing about the fractional curettage and hysteroscopy, let's discuss about hysteroscopy first. So hysteroscopy is basically a telescope, right? So hysteroscopy is the procedure and hysteroscope is the telescope. So this telescope is actually having a light source in it. So you're going to introduce this in deeper vagina of the female, and you're going to visualize the interior of the uterus, the uterine cavity, the tubes and the ostia, and along with that you're going to visualize the endocervical canal and the cervix as well, right? So you're going to visualize everything, the interior of the uterus. So it has the advantage that in case if you want to assess the uterine endometrium, you can use this hysteroscopy, right? So with this help of hysteroscopy, you're going to introduce into the vagina of the female, and with the light source which it has, it is going to reflect in the monitor which we have outside. So with the help of monitor, you're going to observe what is present inside the uterus, how are the tubes and how are the tubal ostias, right? Followed by how is the cervix and the endocervical canal. So similarly, it is like a video camera, right? You're going to insert the camera inside and visualize the video outside in the monitor. So that is the advantage of hysteroscopy, and this hysteroscopy is similar to an endoscope, which is most commonly used by the gastroenterologist. Is that clear? Yes. So we'll be discussing about hysteroscope. Hysteroscope is a very large topic, right? So we'll be discussing this as a separate module. But as of now, as fractional curettage and hysteroscopy is considered, you need to know what is an hysteroscope. So let me show you an image. So the instrument which you see here is the hysteroscope. So this instrument is the hysteroscope. As you can see here, this instrument is inserted into the vagina of the female, and it is seeing the interior of the cervix, the uterine cavity, and it can even further ascend and it can visualize the tubes and the tubal ostia as well. So you're going to visualize the entire uterus per se, right? So this is the function of hysteroscope. This hysteroscope has both diagnostic and therapeutic functions. Diagnostic means you're going to diagnose certain condition. Let's say for example, now fractional curettage and hysteroscopy is a diagnostic procedure, but this hysteroscope can also be used as a therapeutic option also, because therapeutically where you're going to do some treatment inside the uterus for, let's say for example, you're going to do adhesiolysis, such as in cases of Asherman syndrome. What is Asherman syndrome? Asherman syndrome is adhesions between the walls of uterus. So adhesions inside the uterus. So only if you use a hysteroscope instrument, you can visualize the interior of the uterine cavity. So only when you visualize inside, you can perform adhesiolysis. The treatment is adhesiolysis. You're going to break the adhesions which are present inside the uterine cavity. So the therapeutic functions can be such as the adhesiolysis, which has been performed in Asherman syndrome, and the diagnostic approach of hysteroscopy is like this: fractional curettage and hysteroscopy. So is that clear? Yes, this is a short introduction of hysteroscopy. The detailed version will be discussed in a separate module of hysteroscopy. Clear? Yes. So now let's get inside the fractional curettage. So what do you mean by fractional curettage? So let's separate this word into two. So what do you mean by curettage and what do you mean by fractional? So fractional tells me that it is a segment. Fractional tells me that it is segment. It is divided into segment. And what do you mean by curettage? Curettage means you're going to scrap and remove something. Curettage means you're going to scrap and remove something, and always curettage is done with the help of an instrument called as curette. So with the help of the instrument curette, you're going to scrap and remove. But as the name suggests, as you can see here, this is the proper definition of fractional curettage and hysteroscopy. So in case if it is asked in the examination, you can write this as well. Okay, so the uterus is taken into various fractions. So the uterus is not actually divided, but in mind you have to divide the uterus into various fractions. So once you have divided the uterus into various fractions with the help of the instrument curette, you are going to scrap, where you're going to scrap the different fractions of the uterus. So once you're going to scrap the different fractions of the uterus, the sample that has been obtained from each of the fraction of the uterus is put into a separate sealed and labeled container. So it is put into a separate container. Let's say for example, this is the container, and this container has to be sealed. Yes, this container has to be sealed, and this container has to be labeled as well. It has to be labeled. Right? It has been taken from this segment of the uterus. So let's say for example, you have divided the uterus into 4 fractions. So this label has to include which fraction of the uterus the sample belongs to. And once you have divided the samples, you have to send it for the histopathological examination. So this is the proper definition of fractional curettage and hysteroscopy. The uterus is taken into various fractions, and curettage is done with the help of curette, and the samples which are obtained from each fraction of the uterus is put into a separate sealed and labeled container and sent for histopathological examination. Is that clear? Yes. So let me show you the diagrammatic representation as well. So as you can see here, in my mind, I'm going to divide the uterine cavity into various fractions. So now I'm going to divide, this is the first fraction, this is the second fraction, this is the third fraction, and this is the fourth fraction. So now I'm going to label it as 1, 2, 3, and then I'm going to label it as 4. So now what I'm going to do is that with the help of the instrument which you see here is the curette. Right? So with the help of the instrument curette, I'm going to introduce this instrument curette inside the vagina of the female, and as you go inside, you are going to scrap the tissue from each of these fractions. So we have 4 fractions available here, and you are going to curette, that is, you're going to scrap the tissues from each of the fractions of the uterus. And let's say for example, if the tissue sample is taken, which is scrapped and taken from the first fraction, this has to be put in a separate container which is labeled as first, and the second sample has to be put in a separate container which has been labeled as 2, and the third fraction has to be placed in a separate container, a sealed container which has to be labeled as 3, and the fourth fraction has to be put in a separate sealed and labeled container which has to be labeled as 4. So separate fractions, take the curettage, scrap the tissue from each of the fraction of the uterine cavity and put it in a separate bottle which is sealed and labeled and sent it for histopathological examination. So this is what it is called as fractional curettage. You're going to divide the uterus into fraction, curette each of the fractions and keep it in a separate bottles which is properly sealed and labeled and sent it for histopathological examination. So now you tell me, endometrial biopsy is a procedure where you're going to just remove a tissue sample from the endometrium. Let's say for example, I'm going to remove a sample from here. and I'm going to subject this sample for histopathological examination, and the report is going to come to me. Similarly, where in fractional curettage and hysteroscopy, sample has been taken from all the separate fractions of the uterus, right? So the entire uterine endometrium is assessed in the fractional curettage and hysteroscopy, so nothing can be missed out. Whereas in similar endometrial biopsy, the actual site of the cancer or the tumor could be missed out, right? Or let's say, for example, the endometrial hyperplasia could be missed out because you are going to take the sample only from a specific region of the uterus. So since you are going to take sample from a specific region of the uterus, there are high chances that the atypical features which have been present in the malignant cells which have been present in the endometrium could be highly missed out. So therefore, assessing the uterine endometrium on the whole, which we do it in fractional curettage and hysteroscopy, is more sensitive than the endometrial biopsy, that is the endometrial sampling. So that is because this fractional curettage and hysteroscopy is taken as the gold standard investigations in assessing the uterine endometrium. So now you may have the doubt that you discussed about dilatation and curettage, right? Dilatation and curettage which is also done with the help of hysteroscopy. Now what about this procedure? So in dilatation and curettage, where you're going to dilate the cervix and you're going to introduce the curette inside, you are going to curette randomly from the uterus. So randomly you're going to curette the uterus, and the sample from the whole part of the uterus is actually scraped out. But you cannot be more specific that from which part of the uterus the sample is actually removed. So generally, randomly, you're going to curette whatever tissue has been present inside the uterine cavity and put it in a single container and subject it to histopathological examination. But in fractional curettage and hysteroscopy, each of the fractions of uterus is assessed separately and put it in a separate sealed and labeled container and sent for histopathological examination. So it is even more sensitive than this dilatation and curettage with hysteroscopy. So therefore, the gold standard investigation in assessing the uterine endometrium is none other than the fractional curettage and hysteroscopy. Fractional curettage and hysteroscopy. So as I have depicted in this image, which you can see here, so this is the hysteroscope, right? So this is the hysteroscope and this is the uterine curette, the one which I'm going to introduce now inside the uterus. This is the uterine curette. Now, with the help of the hysteroscope, you're going to visualize the interior, which you will be seeing in a monitor here. The monitor will show you the interior of the uterus. So now, with the help of the curette, I'm going to take the sample from separate fractions of the uterus, right? And I'm going to put it in a separate sealed container which has been labeled as from which fraction of the uterus the sample has actually been taken, and you're going to subject it for histopathological examination. So this is the entire process of fractional curettage and hysteroscopy. So that is the reason. That is because it is more sensitive than endometrial biopsy, and it is even more sensitive than the dilatation and curettage plus hysteroscopy. Right? Yes. So this is all about the fractional curettage and hysteroscopy. So now, what is the indication of fractional curettage and hysteroscopy? So I told you that in any patient coming to you with complaints of abnormal uterine bleeding, you're going to do UPT. If UPT comes to be negative, you're going to order ultrasound. If in the ultrasound the endometrial thickness is going to be increased, or if she is a female who is belonging to age more than 40 years, or if she is a reproductive age group female and her endometrial thickness is more than 12 millimeter, right? In all such cases, you're going to do what? You have to do the endometrial sampling, because you need to assess the endometrium for any endometrial hyperplasia. So you will do the endometrial biopsy. If the report of endometrial biopsy comes out to be endometrial hyperplasia with atypia, what is with atypia? With atypia means atypical cells or atypical nuclear features are present. So the chances of progression to malignancy is much more, right? Nearly 40% chances are that for the progression of this endometrial hyperplasia with atypia to the endometrial cancer. So for that reason, in order to rule out any pre-existing endometrial cancer, you have to do the fractional curettage and hysteroscopy. You assess the every single fraction of the uterus and send it for histopathological examination and confirm the findings. And depending upon the age of the female, whether she is an elderly female, a reproductive age group female, the treatment options will vary. So now we have discussed about the fractional curettage and hysteroscopy. So since we have discussed about fractional curettage and hysteroscopy, in the subsequent module we'll be dealing about the treatment of endometrial hyperplasia with atypia and the treatment of endometrial hyperplasia without atypia as well. Right? So I hope this topic is very easy and simple for you, so that I have made it very simple for you as much as I can. So in the subsequent module we'll be discussing about the treatment of endometrial hyperplasia, and we will also deal about the hysteroscopy in a separate module as well. And please subscribe to this Mackler handle so that you will get the daily video updates, and please try to attend the quiz sessions which have been conducted in the Mackler Instagram handle as well. Thank you.